Hey there. First of all, to everybody who has been following me on YouTube or was, apologies for the very long silence. Last couple months have been really tough. Lots of stress and, uh, husband working a lot and 4-year-old being 4 and trying to do my best with my business has been uh, just a lot of stress. Um, But I am going to try to start doing some recordings again because I need to check in for myself on the next couple of months. The reason I decided to start vlogging again is that I finally have a date set for a surgery that I've been meaning to have for a couple of years now. So first, a little background on that for those of you that don't know me and don't know what has all been happening. I have a condition that developed during pregnancy and got worse after pregnancy with my abdominal muscles. The medical term for it is diastasis recti. Um, in a nutshell, it's that my abdominal muscles have separated. They kind of split down the middle, and that happens a lot with pregnancy, but usually they knit back together postpartum, and instead mine got further apart. So the condition got pretty severe, and for a couple of years I was too busy with life to really notice that it wasn't getting better. And then I was like, wow, I really need to start doing some sit-ups. Well, started doing some sit-ups and noticed that I still get the football shape to my abdomen, which happens during pregnancy but isn't supposed to be there when you're not pregnant anymore. Um, so I started researching it, found out what was going on, started talking to doctors, and I can give more history in another vlog, but I just, in a nutshell, where I am today is that I have severe separation of my abdominal muscles, um, which means I have a big hole in my stomach. I've been trying to get up the courage to show a profile shot. I don't know if I'm going to do that yet today, but I'm going to stand up to show you the area that I'm talking about. Um, I don't look so bad from the front, but basically, my abdominal muscles have, they're supposed to be like this. And there is a line in the middle, a membrane called the linea alba that uh, is kind of holds the two together. And when you get pregnant, sometimes, not always, but sometimes, these abdominal muscles start to pull apart. You got to make room for baby. But mine have grown further and further apart. Now I have a hole about this big between my abdominal muscles. So this area here doesn't have muscle to kind of hold everything in and hold it together. And what does that mean? Well, it means that if I am using my abdomen a lot, which for anybody who's ever hurt their abdomen or had surgery on abdomen or anything, you know that pretty much everything tightens, uses your abdominal muscles. When you stand up, when you walk, when you do anything, it pulls on your abdominal muscles. So if I have a long day where I'm not getting enough rest and relaxing the muscles enough, I start to get really sore, and it feels kind of like I got punched. It's like a bruised feeling. It starts in a small area, and then it kind of spreads out, and all of a sudden my whole stomach just feels like it's been bruised all over. It's not anything that you can see. There's no visible bruise, but it's very painful. So that pain drove me to go, okay, well, I've got to do something. I mean, I read up and, okay, some people are like, oh, there's exercises you can do and there's splints you can get, and other people are like, oh, just, get a tummy tuck, just do this, just do that. Well, everybody's different, and I'm not going to say that my case is typical or anything like that. Just for me, where I'm at, if I wanted to do exercise, first of all, it would hurt. Which, okay, I would deal with the pain if I thought it was going to get better, but actually my muscles have separated so much that if I tighten my abdominal muscles, they're going to actually tighten up and pull further apart. They're going to keep separating because they're going to get tight here. So I can't do sit-ups to tighten them. It will actually it'll tighten the muscles just in the wrong place in my body. Um, so how did I get here to being ready for surgery, and what is a surgery? Okay, first of all, um, I have seen 6 doctors about this condition since I discovered that I have a problem that needs taken care of. 2 general practitioners, 2 general surgeons, and 2 cosmetic surgeons. And each and every one of them has had a different opinion about what I have and what will fix it and what chances I have of the fix working. Um, the line, the byline, or I don't know, the bottom line from health insurance companies is, of course, they don't want to pay for anything they don't have to. And most policies you will find mention of the correction for diastasis, the surgical correction for diastasis is that they suture your muscles back together. Um, you know, they go in, they cut you near your pelvic region, they pull up the skin, they stitch your muscles back together, pull the skin back down, and hopefully it stays put, and then you have to keep up with a diet and exercise regimen. This is called a tummy tuck, which is a cosmetic procedure according to every insurance company out there and most doctors and surgeons. So if you're talking about diastasis correction, you're talking about a cosmetic, which is an elective surgery. So no insurance is going to pay for it, and now you're suddenly lumped into the, oh, see, she just doesn't want to exercise, she doesn't want to take care of herself, and so just go lose some weight and you'll be better. I'm a little bitter because the first doctor that I mentioned this to was my primary care doctor in Wisconsin, where I used to live. She was wonderful. When I moved from Wisconsin to Florida, where I live now, I wish I could have brought her with me. She was very understanding. I showed her when I did a crunch what happened to my stomach. I explained the pain that I was having. She's had other patients that have gone through this, and she said, there's a fix for this. There is surgery to be done for it. Um, so she sent me to a general surgeon that has done diastasis correction before. That's where the happy story ends. I went to the general surgeon after having, I think at that time was an ultrasound. I don't think it was a CT. It was an ultrasound of the area of my abdomen where I was having the pain. They wanted to make sure there was nothing else going on, that it really was muscular, which makes sense. My gallbladder is kind of in the general area where I have this pain, but it's been determined that no, it's nothing gallbladder, it's nothing liver, it's in the muscles that are being stretched in the wrong way because they're not where they're supposed to be. So I went and had an ultrasound, which was sent, the results were sent to the surgeon, and she read them, and I went to make an appointment, and I went in and I waited for about an hour for the surgeon to come into the room. I had my then 2-year-old daughter with me, so that was lots of fun, trying to keep her happy in a little bitty exam room with nothing to do. And finally, the general surgeon walked in. She opened the door and said, "I can't help you." She had not ever met me. She had viewed my chart and looked at the ultrasound that had been done of me. And based on my height and the number of pounds that I weighed at the time, she decided before ever looking at me that my problem was I was overweight and I should lose weight and then I would be fine. And if I still didn't like the way my tummy looked, then I could go to a plastic surgeon and have plastic surgery and have it fixed that way. Needless to say, that didn't go well. I started to ask her some questions. I could tell she just wanted me out of her office. She said, well, I'm not going to do this surgery. I've done it before, and what happens is they just separate again because you're going to gain more weight. Okay, well, first of all, you don't know what I'm going to do or what I'm not going to do. And as someone who is already uh, seeing a counselor for an eating disorder that was quite a blow because she looked me up and down, said, based on your height, you are 90 pounds overweight. Go on a diet, do sit-ups, and you'll be fine. That was very, very poor medical advice. First of all, because the sit-ups would have made my condition worse, and two, because her assessment of what I should weigh was completely arbitrary. And I had a counselor to go to after that, and I'd already done some research of my own to realize that I'm never going to weigh 110 pounds. She wants me to weigh 115 pounds, which I haven't weighed since my sophomore year or junior year of high school. I don't know too many people, there are exceptions, but I don't know too many people that weigh what they weighed in high school when they're 35. So I was a little upset after that appointment and went to my counselor and talked to her. She said, do not take what this surgeon said to heart. I don't know where she's getting that figure from. You know, it was just completely arbitrary that she threw out this number of I should weigh 115 pounds. So that was kind of strike one with the surgeons. So I went back to my primary doctor, who apologized and felt really bad for sending me to that surgeon, and said, okay, let's send you to a cosmetic surgeon. Um, not, not all cosmetic surgeries are elective. I believe this is medically necessary because, it was caused by your pregnancy. It's not something that you can correct otherwise, and it's causing you pain. So, but cosmetic surgeon may not be as gun shy about doing this type of surgery. So she sent me to a cosmetic surgeon. He definitely had a better opinion of what my condition was and what could be done, but the time from the first time I saw him to the pre-op appointment, something changed, and I didn't, because I stayed within, he said, as long as you're staying within a 10-pound range of where you're at, he said, I don't, even if you're overweight, I'm okay with doing the surgery. It's if you have some drastic weight loss or weight gain around the time of the surgery that it's going to cause problems and complications with the surgery. So we planned it. I explained to him I have this diastasis. I also have some skin and fat that hangs down. It's the part of the body this is called the pannus, and it's also very common to have removed during a tummy tuck. So I said, well, if I'm going to go under the knife and I'm going to have this corrected, then I would like to also look better, not just feel better. Why wouldn't I? So I'm never going, no matter how many sit-ups I do, I'm not ever going to be able to tighten the skin that was stretched out during my pregnancy and isn't going to go back the way it was. So, okay, all sounds all right. He said I am not a candidate for anything other than the stitching and the removal of my pannus. He wouldn't do any liposuction or anything like that because, as he put it, I'm big all over. Again, that's kind of a rough opinion because I actually have small wrists, fairly small arms, small legs. Most of the weight I carry is in my abdominal region. I'm very apple-shaped, so that's where I carry most of my weight. Uh, so then finally decided, okay, I'm going to go ahead and have the surgery. Went for my pre-op appointment, and it was like talking to a completely different person. I'm not going to stitch the muscles in your abdomen because you're too big, and all I'm going to do is remove your pants. Okay, wait a minute. The whole point of having the surgery was to correct the abdominal separation. The whole point of putting myself through the very painful surgery is to be able to not have this pain anymore, to be able to do regular activities without causing myself pain, and yes, to not look 5 months pregnant anymore. There was a lot of back and forth. I ended up deciding not to have the surgery at that time because I didn't feel like it was I didn't feel like that was what I had gone in, made the agreement about what we were going to do. Also, we were getting ready to move, so I decided, okay, being laid up right now, not a good idea. I can always do it in the future. one thing leads to another, and a year goes by. Um, so let's see, that was surgeon number 2 and the third doctor. So move to Florida, get a new primary doctor, who again looks at me and says, wow, you look like you have actually a hernia, because you have a big hole in your abdominal muscles. Um, Hernia happens when a hole develops and then organs or intestines or something like poke through. That's why they're so painful. So it's, push things back where they belong and sew up the hole so that your abdominal muscles aren't leaving room for something to poke through that doesn't belong there. Well, nothing is poking through uh, the hole in my stomach. So it is not, by the medical definition that health insurance companies use, a hernia needing repair. But eventually that will happen, and then after I've been through a lot of pain and possibly risked other health problems, then they might pay for it. So doctor sends me to doctor number 2, primary care doctor number 2, sends me to a general surgeon who says, you don't have a hernia. I don't do tummy tucks. I'm not a cosmetic surgeon. You don't have a hernia, so just exercise. I was prepared that time for that to happen, so wasn't quite as put out with that doctor. I found another cosmetic surgeon all on my own through doing research on the internet and looking at lots of reviews, and instead of looking at, okay, is this doctor in my network, is who's got the best reputation, who's got the most experience. Um, if I'm going to go through this, I want to make sure I trust the person. So, cosmetic surgeon number 2, doctor number 6. Went to see him. He is the one that is going to be doing my surgery on May 31st. I'm not going to mention his name until I've checked with his office and made sure that they're okay with me mentioning his name. But he has a very good reputation. He has a private practice, and I really like his staff. He he looked at me and he said, very honestly, the more weight you lose before the surgery, the better results you're going to get. And his concern was, if you have too much pressure inside of your abdomen pushing on the muscles that I'm going to repair, there's a chance that they could tear again, and we don't want that to happen. So instead of saying, go lose 90 pounds and do sit-ups, he said, try to lose some weight. He knew that I was seeing a counselor and that I had an eating disorder. He said, do what you can do, and even if you lose 10 pounds, it will help relieve the pressure on your abdomen, and then we'll look at you again. So then almost a year went by again, and because of life, and I did lose weight, partly due to the juicing that I started last fall, which if you look at my other videos, you'll see me talk about. And just changes to my own situation because of my eating disorder, making some more progress on not turning to food when what I really want is something else. So I did lose about, well, at least 15 pounds. I don't know if it's more than that because I don't obsessively weigh myself. It's not good for my eating disorder triggers. Went back to his office. He said, yep, I could do it now. Again, he restated, if you can lose more weight, it's going to make the results better. But now we were out of the, okay, this is a safety issue question and into the, how good do you want to look after the surgery question. So I'm safe to have the surgery, and it's just how healthy can I get before the surgery. So that is the whole point of me starting this video, is so that I can start updating on changes that I'm continuing to make, and differences in my health. I have already started doing the juicing. I did a juice detox last fall. I haven't done one since then, and I want to do another one before the surgery. One, to just cleanse out my system before surgery, I think is good. Two, the incidental weight loss that happens with that can only help. You know, flush out the toxins, clean out the body, and that'll be good for the surgery. I have more energy when I'm detoxing, so that's going to help. I've already started doing some exercise in the form of walking. It's the best one for me because it's the least likely to cause me a lot of abdominal pain. Um, so I'm planning on recommitting myself to that. And I haven't decided exactly when to start the detox yet because for me, I need to give up caffeine and wean off of meat um, before I start juicing exclusively because the triple hit to my system, I don't do well. I tried to do a detox without doing that ahead of time, without giving up the caffeine beforehand and the meats, and it didn't go well. I didn't last a day because I was so hungry that I cheated and then I felt bad. So first step is to get off the caffeine, and over the course of that week, give up the meat, and then I'll start that. I'm trying to decide if I'm going to do a 5-day or a 10-day. I haven't decided that yet. I'll talk about it when I make those decisions. But this is the beginning of the prepping for surgery on May 31st. Um, I have my pre-op appointment on May 16th, so I'll have more information at that. But this is finally happening. There's a light at the end of the tunnel for me for feeling better, and I'll have a whole nother video about the emotional impact that this is all having. But this is my story up to this point, and here we are. So I know this was really long, and I hope you stuck it out to the end. And thank you for listening. And if there's anybody else going through this, I'd love to hear from you because we got to stick together because the insurance companies, the doctors, society, everybody has an opinion about what this is. But unless you're living with it, you don't really know what's going to fix it. You don't know how it feels to have it, and you don't know what it's like to walk around and have people look at you and not be quite sure. Is she pregnant or is she just that uh, shaped? I don't know what the. I'm trying to think of a benign word, and all I can think of is bad ones like deformed. Um, it's a tough thing to live with. You want to kind of turn to people and say, I'm not always going to look like this, or I didn't always look like this, and this isn't my fault. This isn't because I ate too many Twinkies. This happened for other reasons. Um, so I hope to check in with some other people that are dealing with this. I know they're out there. And so with that, I will sign off, and I hope you have a great day. And hopefully, it won't be another 3 months before I get back to this, because then I would have had the surgery already. But I'll try to check in. I don't know if it's going to be every day, but I'll try to check in frequently to let you know how I'm doing and to give the accountability to myself for checking in. Take care.